was born there. And also, we had the highest church tower in the world until I think probably some weeks ago. Now it's in Barcelona, but still it's a nice church. What I'm very fond of is this little lion man, this ivory lion man. It's 30 centimeters high, and it's about 40,000 years old, that had been found in the caves there around Ulm. So you can see it in the museum. We also had a nice design school, but it was closed in 1968. Unfortunately, it was a Bauhaus Nachfolge, and of course we have some nice architecture. And there are two occasions you can come to Ulm this year. The first one is this International Summer School of Epi, or you can send your associates. It's the 34th summer school in collaboration with UNC Chapel Hill. We have a very long collaboration with colleagues from the Epi department in Chapel Hill, and I'm very proud of that. I was also at that school, and the program is on our homepage. And we have also the third time we are organizing the DG Epi in September in Ulm. It's another reason to come. So actually, abstract submission is already open, and I hope to see some of you there. Probably nice would be at both occasions. So Ulm is in the very south, so it's about a 6-hour, 20-minute train ride, and I recommend to take a train directly from Ulm to Bremen or vice versa. There are trains, you don't have to change, so you are then absolutely sure that you don't miss a connection. And I'm talking about these two birth cohort studies. The first we started together with Hermann Brenner, which was my mentor and my boss in earlier times in 1999, 2000. This was funded by the German Research Foundation, by the DFG. And then I traveled a little bit around, from Ulm to Heidelberg, from Heidelberg to Basel, and again back to Ulm. When I came back to Ulm, I said I have to do another birth cohort study, and I studied this with Jon Genonite in 2012. A little bit of more modern one. You can see it on the logos, but still, and I'm going to talk about these two birth cohort studies, how we did it, actually, what kind of surprises we saw, and I'll share some of the results. Each of these birth cohort studies, they have about 1,000 newborns and their families. We included always the whole family, not only the mother and the child, but also the father and the sisters, if there had been. So we used a similar recruitment strategy, though the core of the variables is pretty much the same, because the idea was we can also combine then these two studies, or just look on differences in terms of what happened within these 12 years, to look on period effects, cohort effects. And the sampling scheme was also very similar. So we did the baseline recruitment was done in the University Medical Center. And that was the only, I would say, maternity hospital in Ulm and adjacent region at both times. So that's very good, because then we have really a clear population-based, I would say, study. And I think Ulm is a relatively little city with about 120,000 inhabitants. And as you can also see, the response was quite good in the early years with 67%, and was quite a little bit lower, 49% in the second one, but I think it's really difficult. I see this in many studies to convince people to be part of a study. It had been easier 20 years ago. So in these two studies, this is the story and the history of the first study. It was actually the Helicobacter pylori, the stomach germ, that at that time, when we started together with the internal medicine in the 90s, we did not know anything about this Helicobacter. Where does it come from? What is about transmission? No idea at all. So the first culture took place in 1983 by these two gentlemen. This is Barry Marshall, actually, in turn, and this is the pathologist, Dr. Barron. And they actually, by accident, cultured this H. pylori the first time. And this was because the doctoral student forgot the plates over the Easter. They then had some days longer. They had been tying the glue, and then finally Helicobacter pylori grew. And this gentleman then did a second experiment, so a very heroic experiment. Actually, he drank a mixture of this kind of H. pylori to demonstrate, gastroscoped himself to demonstrate if you drink this thing, you get a gastritis. Now, the problem was it was not, at that time, it was not quite easy to get rid of it again. So he had quite some problems. And the first therapy recommendations then to eradicate Helicobacter pylori came in the 90s from the National Institute of Health and, of course, also from the European H. pylori Study Group. But if you look in history, back in history, the interesting thing is that already in 1906, a German pathologist, he had described these bacteria in the stomachs and saw them under the microscope. This is actually a picture from Günther Bode, my colleague, because Ulm was also famous for Helicobacter pylori research at that time in the 90s. And they were a little bit later than this Lancet letter from Warren and Marshall. So they were quite close, but usually nobody talks about the second. Okay? That's just how things are in life. But then actually, these two guys, they got the Nobel Prize in Medicine and Physiology in 2005. But at that time, was the epidemiology of Helicobacter pylori was totally unclear. We didn't really know where does it come from, how is it transmitted, who has it, how is the burden of this kind of infection in the population. And then we started in Ulm, Hermann Brenner, and actually Guido Adler, the chief of the internal medicine department, to write a grant for the DFG, to do some kind of medical, this was faculty funds, to do cross-sectional studies. If you don't know where something is coming from, start with cross-sectional studies, and because you can look on many, many factors. Okay? We investigated then school entry children, all 1,000 children in the city of Ulm who, with a public health, with the Gesundheitsamt together, 1,000 pupils, Ulm and adjacent regions. We looked on patients of a general practitioner. We looked at elderly. What we found in these cross-sectional studies was, so the housing density, nationality determinants of infection. Pets or animals, cows, horses, dogs, they are no risk factors. Even flies, because they had some papers, some flies actually may transmit this. We didn't find anything of that. There's also no transmission among siblings and among small children in kindergarten. We didn't see their differences, even if children from populations or from Turkish children were together with German children in the same kindergarten. This was not a risk factor at all. The only thing we found is that the ALCUS history, because we didn't investigate the mothers, we just asked, did you have a history of, did a doctor diagnose ALCUS? And this was the only main determinant, and I'll show you here the numbers. Basically, if the mother had a history, the odds ratio for child's infection at that time was 11.7. These are incredible high odds ratios, and I had never have seen such high associations in my whole life, I must say. This was a good start, of course, because usually we are dealing with much smaller risks. And if the father actually had a history of Alzheimer's, it was only 60% increased, and you see the broad confidence intervals. But usually we measured the H. pylori infection with this kind 13C urea breast test in the children, in the school children, and in the accompanying parent, which was in 80%. The mother usually goes with and we had therefore we only had 20% of fathers. Sometimes the father was also coming with the child, but you see, this was the first evidence that the mother plays here an important role. You can also see that this population of 1,000 school entry children and their parents. There are huge differences within this population. So actually children that had been born in Germany had 5% at the age of 6, 7. The parents actually 25%, 27%. And these are Turkish fathers and mothers and children. And you see almost every second Turkish children was infected, and 86% or 84% of the parents had been infected. And this is quite the rest. But this was the first idea that something is going within the family. But these were only cross-sectional studies, and therefore we thought we need a cohort study to actually really examine what's going on. This was the press echo of this kind of first studies, you know. I got a lot of angry letters, you know, the deadly kiss and the link transmission of cancer, bug, Helicobacter, mother and children, you know, how this will actually, because the mother-child bonding is so important, and you just report this kind of research, you know, that was quite a thing that I had to struggle with. But of course, I'm sure you have a good press department that will then deal with that. At that time, we had to do it all by ourselves, and actually control these kind of things that go out. And I'll show you already the results of the first cohort study after 4 years of follow-up. And you can see here the children and the fathers, the mothers, we use this urea breath test, which actually gives you a very good picture whether there is a H. pylori infection in the stomach. Yeah? So it's it's really a very good test, and it's absolutely no risk and no side effects. And after 20 minutes, you have the results. But for the follow-up and for the parents, usually we use this antigen test in stool, which is also very exact, and it's also a very good test. And then if you look after these 4 years of follow-up, we still had a very strong risk association with the mother's infection, which was about still odds ratio was 13. Of course, very broad confidence interval, but the father, and because we also tested the siblings, actually we couldn't really establish here a risk increase that was not containing, or the 95% included here the null effect value. So we could confirm this kind of association that came first from these cross-sectional studies, now in this Ulm birth cohort study, already after 4 years of follow-up, which is quite early. And here I just display against the main features of these 2 birth cohort studies. We had already talked about the response, 67%, 49%. But we have similar populations, we have the same sampling frame, we have a similar core methodology. The question is, the focus here was H. pylori, but also we included allergic diseases, the body composition, quality of life. But this kind of second birth cohort study, the focus was more on psychosocial stress, but also allergic diseases, BMI, and also quality of life. And we already collected a lot of biosamples at the time. Yeah? We had serum of the mother, we had cord blood, we had also human milk collected at 6 weeks, 6 months, and in the newer birth cohorts also after 1 year. We have still a lot of material in the minus 80-degree freezers. We have also DNA of the children, we have saliva, we have stool, because we determined H. pylori infection. We still have stool on stock, blood, and we have also serum trios, because at 8 year follow-up, all had been invited in the medical clinic again, and we investigated father, mother, and the index child. And here in the viewer, we even have RNA Here we have, because we focused on psychosocial stress, we have also collected hair and measured cortisol in hair. But I can say, because in 3 centimeters of hair, it's an aggregated measure of cortisol, but it's a very complicated biomarker, I tell you. Yeah? It was really not really easy that actually you find an increase in cortisol in the hair, and you see in the ticks or in the stress questionnaires, you don't really see a good agreement. So you can measure it, of course, very, very exact, but it's a very complex and complicated biomarker. I haven't understood it so far yet, but we have it also. We have hair from mother, father, and child. The first birth cohort is already closed, and the second actually is ongoing, but I think we have to close it soon, because now we just have response of about 300 or 400 parents, and then actually, the effort is not really worth to continue. Now they are 13, 14 years old, and I think it's probably we have to stop it because we don't have actually funding. But one word to recruitment. If you start recruitment, it's very important to really start a public relations campaign. We included all the gynecologists and even had big posters in all gynecologist practices in Ulm, that every pregnant woman would see this huge poster that already told them there is a study at Ulm University, and if you are interested in the health of your child, please contribute to the study. Or we went to the information events for the pregnant woman, because usually they look on several medical clinics. Do I want to give birth in this clinic? Of course, it will be only had one, but also 30 kilometers away, there's Langenau and there's Blaubeuren, and they usually take long ways if they think that it's better. But I went there and made some advertisement. We had involved local press, local radio, local TV, and also we informed and included the office-based pediatricians also. I went to their quality circles and advertised this kind of study that is coming. So do as much as possible before it starts. And also a word to the ethical vote. Don't be too narrow at the beginning, because you never know what comes. So actually, I would write it different today, because here you see the material was übereignet. So actually, we are the owner of this material. You have much more rights on that. Yeah? Ein Teil der Proben wird eingefroren und in anonymisierter Form. Today I would write pseudonymisiert. Ohne zeitliche, without temporal limits. We can keep it in the freezer. Usually you have to tell the people how long is the material stored, And here we have also, I think the idea was that you can do things that we even didn't think of when we started and to the study. So that's very important that you are as broad as possible. Of course, the ethical committee, they say you exactly have to tell the people what you want to do. So it was a big discussion. Three, 4 times it went back and forth that we said, yes, but we don't want to be too narrow. And at the end of the day, we were successful. And still, I think we have these very broad statements in the patient information leaflets. And what we also did is we all created study incentives, newsletters, homepage, lotteries. We actually birthday presents for the kids. Usually we contact them at their birthday, and then they get a small present, and the questionnaires come. Or we organize flea markets for the whole population, for the whole, that they could together, because if there was a general flea market, we said the Ulm Study has also a site, you can bring your clothes, you can bring your Kinderwagen or whatever, and there's something to drink, there's some food. So actually they could really talk to each other, and it was really a community. And of course, we presented results in newspapers. Of course, the presents, they also have to be small, because we have to send them by mail. Yeah? This is just one example for a birthday present that there's every year. Of course, you have to come to a different idea. Yeah, but it should go in an envelope. and it should not, the porter should not be too expensive so far. So these are the postcards they get for Christmas, you see. We also did some kind of branding. This is the Ulm SPATZ, is a bird. Yeah? The Ulm SPATZ is the name of the study. And we did this newsletter, SPATZ gets richer. Can you see this deals with sleep? Now this deals with book reading. This deals with media consumption. And this kind of newsletters, we usually always tell the people and the parents and the families what we found in our studies in a simple language. So actually we stay in contact and we tell them, look, this is what we found, and please stay with us because the results of the study will be better the more people stay in the study. And we have home pages. Of course, the recruitment actually we did with doctoral students, 7 days, 365 days, 7 days a week, 350 the whole year. They had to go every day. They had to go to the clinic and look, had a child been born. There you need really very, very trustful medical students because they organized it by themselves, but it worked very well. And of course, here is also information for the participants, for the physicians, for scientists in general. So actually, we always try to be as transparent as possible and show as much as possible to them. Here is the structure of the study. There's a lot of things. So actually, in this first study, we collected human milk, 6 weeks and 6 months, and then we had these yearly follow-ups. We had a parent questionnaire, all this content. We had pediatricians questionnaire. We did it always in parallel. We involved the pediatricians and the parents. We collected this human milk. And at 8 years, plasma serum and this other material, when we invited them, there came 550 came to the clinic from this route, which is, I think, after 8 years, quite good. And here, this cohort study is something special because after 11, we had a special child questionnaire. We had an envelope secret, only for the children. And from 11 on, know that we asked them questions and they could put it in the secret envelope and glue it. And there was information the parents shouldn't know. And this was from 11 on. Here is special that with 20 years, I invited them and I asked only the males for semen because I had a special study and about 100 of them came and collected and gave me 2 semen samples. I'll show you some results later on. This is the second West cohort study, very similar, but here we also collected milk 1 year and the same thing. No, but still we didn't manage it to get all of them back in the medical clinic. And this is a difference. The first study, because we didn't have the funds, but it would be very, and here the questionnaires are quite, the course are the same. But basically here it was more on psychosocial health and mental health and this kind of thing, and also the trauma of the mother and these kind of things, and hair cortisol. But I'm not sure whether I would do it again because it's so complicated to interpret. Okay, with the milk, the milk is a very special thing, you know, and therefore very early we already asked the industry for help. This is Christoph Beermann, actually, Christoph Beermann. He was at Melupa at that time in Friedrichsdorf. I asked them, we want to collect milk because the first idea was we're just interested in antibodies against Helicobacter pylori. Is it in maternal milk? That was my idea, just to investigate this, and we did this. But of course, we had not the expertise to handle this. The sampling is very complicated, you know, the processing and the storage and the analysis. Therefore, we got this kind of cooperation with the industry. Melupa was bought by Numico Research, and we are collaborating with Numico Research since then. And it was quite I would say, a successful collaboration, you know. We had so far, we had over 20 peer-reviewed publications. We had, with a quite good impact factor, we had even 2 patents. And here this picture shows you also the difference between these 2 studies. Mothers are now older, they are better educated, they are less smoking, pre-pregnancy, they have a little bit more allergic diseases, and the children, you see here some of the features. One important or interesting aspect, cesarean delivery was in Ulm very low. In the first cohort, it was only 17%. In the second, it was quite higher, 28%. I think it's every third. And they were very proud in Ulm that they actually had cesarean delivery. It was so rare and only was done when it's really necessary. But here, really, this collaboration with the industry was very important because we alone couldn't have handled we had not the expertise how to handle this material, and they helped us quite a lot. Here's an example, we always, if we have the 500th mother, they got a flower. Yeah? Of course, here 99, things are changing, and we can describe how. So this, some of the doctoral students, this is the head of the Entbindungsstation. This is on Genonite and medical document personnel of our study. And I'll show you here two results, in terms of breastfeeding patterns in our birth cohorts. But you can see, of course, in the newer SPATZ cohort, more people are breastfeeding, and they are longer breastfeeding. There's a difference between these 2 studies. Okay? This is now exclusive breastfeeding. 6 months is recommended, and you can see it's quite a different picture. Here, the older cohort, actually, the probability was higher at the beginning, but then actually it overlapped. And we also looked on determinants. Why are mothers stopping breastfeeding? And that's the interesting part here. After 2 years, we followed them for 2 years, and then we ask about, of course, the smoking habits. We ask in 6 weeks, 6 months, 1 year, 2 years, and then we reconstructed the smoking habits. And you can see here, the highest probability of breastfeeding is non-smokers or the people that manage to abstain it up to 2 years. And mothers that relapse by 2 years or even by 6 months or even smoked at 6 weeks, they have much lower breastfeeding probability. And this is really an important finding because this gives opportunity for intervention, of course. There are very important determinants of relapsing early is if the partner is smoking, and school education and adiposity are the personal characteristics. So actually, we would have here a group that would benefit from a really targeted intervention after birth to help them to abstain from smoking, but they would need a special program that is tailored to their socioeconomic characteristics. But actually, the difference is so incredible that it would be worse to help them to abstain smoking longer. But so far, I think there are no programs. What we did also is, I told you, we asked the mothers about maltreatment in their history. Yeah, the mothers had been asked, had you been physically or sexually or mentally treated badly in your history? So here we used the childhood trauma questionnaire of the mother. What we saw here is actually that if a mother had reported that he had experienced some kind of maltreatment, that the children at age 4 to 7 years, they had a higher burden of behavioral and emotional difficulties. So actually, this is really a transgenerational aspect, and there we have adjusted for many things. This we have done together with the people from the Deutsche Zentrum für psychische Gesundheiten, from the Psychotherapie and Kinder- und Jugendpsychotherapie, Professor Fegert in Ulm and W.A. Clemens. And because we have these longitudinal things, we could also look on the association of mental health during the COVID-19 pandemic, yeah, and sleep characteristic, all these kind of things, because we have the respective questionnaires. So there's one thing what I really liked so very much. I was very fond of this study and initiated it. Bring different data sources together. Of course, we also have in the Forschungsdatenzentrum in Germany, great hope, great thing. But we have to talk how we can really benefit and bring data together. Here, every child that goes in a school entry examination draws such a picture. It's called the Mann-Zeichen-Test. And there is a list, it's a very old thing. There's a list of 50 criteria. You can categorize these pictures, and then you get an idea of the mental development, of the cognitive behavior, and the cognitive development of children. That's the use whether the child is really able to go to school or should wait another year. And we combined these kind of results from the Einschulungsuntersuchung with our data. Of course, I had to ask every mother, every parent, whether they give me the consent to combine this data. And I had to get another ethical vote. It was quite complicated, but at least I think I ended up with several hundreds of them. It was interesting because, of course, there's a difference between girls and boys. Girls are just have a better cognitive development at the same age, in this preschool age. But what we really could show here is that also, especially at boys, that the media consumption in boys was really associated now with the cognitive development. Also, the more media, not the better. Okay? It's quite the other way. So the more they had to consume the childhood, at that time it was not smartphones, so it was basically video on television and these kind of things. But it had really, even after adjustment for socioeconomic factors, actually, especially in boys, we saw really an impressive association. And I think that is really an important thing, to combine different data sets with cohort study data, and because you get so much more information in your study base. And this is another topic we also worked on. This is book reading, substituting book reading for screen time benefits. So you can see the media use at age 4, 5, and 6. It's, of course, media use minutes per day. This was reported by the parents increased. The book reading, of course, decreased. But what we really saw, and the outcome here, is sleep quality, because we had also the children's sleep questionnaire included, reported by the parents, of course, but screen-based media clearly associated with slower sleep quality. And this is a very interesting substitution model. But if you're interested in the technique, I'll just please read the paper. If we substitute 50% of the time spent on media, we would substitute with book reading. Then you can look on this kind of the total score of this sleep questionnaire. A lot of the scores get better. So that is another way to show and to display this kind of association. And here I have another example we are currently doing in collaboration with the Leibniz-Institut für Risikobewertung. They came to me and said, you have breast milk in the freezer. We know that. And we are interested in measuring dioxin and PFAS in breast milk and in serum of mother. Couldn't we look on semen quality in these young men now? First, I've thought, because it's quite a different, the exposure is quite interesting, but to get the outcome, to the semen, so from these young boys, I thought it might not be so easy. I asked my boys and they said, oh, for 150, we will do it. So actually, we ended up at 150. It's easy earned money, they said. Of course, then we got about 100. Yeah? And the dioxin exposure, 20 years ago in the maternal milk, that was quite a severe number. It's 0.51 picogram per gram milk. And the PFAS exposure was 10.8 microgram per liter in the serum of the mother. And then we constructed cumulative dosing and how long did they breastfeed, and then to come up with a cumulative dose. And the idea is that in the first weeks, months of life, there is a critical window when this kind of, I should have it here. The dioxin exposure in fetal life and early infancy may be harmful for the male reproductive system. And there there's almost no data. There's a Russian study that actually measured dioxin levels in 9-year-old Russian boys and semen quality in young adulthood, and they found an association. But really, findings in the background range have currently not been confirmed by other studies. So actually, I had to ask all the mothers, can you give me the address of now your 20-year-old boy? Because I could not ask the mothers, we would like to do a study and collect semen from your boy. Can you give me his? Because otherwise, I think they would not be so compliant. But I'll just in general, as I said, we are doing a study, Gesundheit im jungen Erwachsenenalter, and I would like to contact your son. Please give me the name. And then we contacted the sons directly without displaying the mother what we really want to do, because otherwise I think there's still some kind of, if you collect semen and your mother knows it for 150 euro, actually it might be an unpleasant discussion on Sundays if you're home. So that's why we did. But if they want to tell their mother, they can do so. Yeah. But for this procedure, we also get the ethical vote. And could do it this way. So actually 98 came, and we could analyze 98 subjects. What we found actually in these kind of complicated models here, if you look on dioxin on the single consideration, so this is only dioxin and adjusted for potential confounders, we don't see an association between cumulative exposure to dioxin and these kind of different outcomes, total sperm count, sperm concentration, progressive motility, or total progressive sperm count. If you look on PFAS, actually on single consideration adjusted, we saw suddenly a positive association between increase and sperm concentration. On a biological point of view, does not make sense. PFAS is a poison. Why should it be good for your sperm concentration? And the interesting thing is if we look on both combined, so actually if I simultaneously consider dioxin and PFAS, actually we suddenly saw here a decrease. You don't see here a positive association, it's gone with PFAS, but you see here negative association between dioxin concentration and sperm concentration and progressive motility, the motility of the sperm. So actually that's quite a surprise. And how we interpreted it actually, when simultaneously considering dioxin in human milk and maternal PFAS serum concentration adverse associations from prenatal dioxin exposure with sperm concentration and with progressive motility were seen. However, the small sample size and other potential sources of bias are confounding, and the simultaneously adjustment for factors which are oppositely associated with endpoints in our models require cautious interpretation. So, and what we think is that the positive association with PFAS, this might indicate residual confounding and reflect the protective bias, of course. PFAS is usually in fish and in other things, and probably we have here a protective bias, and for other factors we cannot characterize it. So that actually how we interpreted then these results. But we have to look now in more detail about the determinants of PFAS and dioxin in these subjects, because we have quite a lot of information. So what are we currently working on? So we looked at maternal employment patterns of the childbirth and child mental health. We looked on child and parent sleep characteristics before, during, and after the COVID. And this is already published. And we're currently doing in the context of this DZKJ, German Deutsches Zentrum für Kinder- und Jugendgesundheit, which we are lucky to be part of this kind in Ulm. We are looking on doing regional patterns of obesity. We do geocoding, and spatial health is a descriptive way, to look on distribution patterns. And we are more early determinants of disease, these PFAS measurements in serum of mothers and risk of atopic diseases, adipositas, infectious diseases. So we measure currently PFAS in all the serum of the mothers, and then to see whether it has an effect of the outcomes of the children. So there is quite, the results are quite different so far. So I am done now. I think I want to end with the acknowledgement, because this is a large collaborative effort, this kind of first cohort study. And of course, you should involve as much as possible, from the clinical partners. You see how many people have been involved, even, and also the Ulm Public Health Department was very important in this kind of beginning of the study, when we had investigated all this school entry data. And of course, always I need to thank all the participants in our studies. And I think we have still some time for discussion. I'll show you this nationwide team of the DZKJ, which might be of interest to you. These are these kind of standards that are now coming together in this Deutsche Zentrum. We are now in the second year, Deutsches Zentrum für Kinder- und Jugendgesundheit. This is, you can see it here. They have also a nice web page. And of course, we in Ulm are also participating with our cohorts in there. And we are especially then working on early determinants of health and disease. There, of course, are other topics, obesity, metabolism. This is quite information you'll also find on the web page if you're interested in the topics and in the work of this DZKJ. Then I'm just thanking you for your attention. It was a very rush. I'll give you the list of publications that we have so far. It's over 70, and of course, if you would like to see the other in hand, you just write me a mail, and I can send you the PDFs. If you are not allowed, I have to look for it later, and I'm happy to send it to you. Then thank you, and I'm open for questions.